If you have failing teeth and you need to have them all replaced, or you're sick of your full dentures and you want to have a fixed solution, there are a number of options for you. The most common term that people hear about nowadays is All-on-4. It's become a very popular solution to this problem, and there is a reason why it's so popular, even though it's not the only way and it's not always the best way for some people. But essentially what All-on-4 is, it's one way of replacing missing teeth. We use 4 implants in the upper jaw, 4 implants in the lower jaw, and we attach a bridge to those implants. And the bridge is typically anywhere from 10 to 12 teeth all together. Some people think that it's a series of individual teeth. No, it's one piece. If you can imagine the horseshoe-shaped bridge that replaces all your teeth attached to 4 implants, that is essentially what All-on-4 is. The beauty about this procedure, and that's why it's become so popular, is that a lot of the times, from the time that we remove the teeth and place the implants to the time that you have some sort of a fixed solution or some sort of fixed bridge, is overnight, or certainly under a week. And that appeals to people naturally, because with traditional ways of implant replacing, often people used to wait, sometimes for years, from the time of removal of their teeth to the time that they could actually have bridges, sometimes up to 2 years. So that is a huge advantage of this treatment. One of the disadvantages that I see is that we use a minimum number of implants. 4 implants is the absolute minimum that can hold a bridge. If you lose one of those implants for whatever reason, or it doesn't take, then we've got a situation where you have only 3 implants left, and 3 implants can't actually support a bridge. So we would have to remove the implant and try to replace it, or in some situations even have to regenerate bone before we can replace that implant. Whereas with traditional methods of replacing teeth with implants, we used to place anywhere from 5 to 7 implants, and a long time ago even more than that, thinking that 1 or 2 or 3 might fail. But see, the thing with implants is that most of them do take, and most of them don't actually fail. But the more implants, the better still is the case, and it still holds true in situations where if you do happen to lose 1 implant, you still have 5 or 6 implants remaining to support the bridge. So it's not such a great loss in that situation. In other words, conventional implant treatment might be a tad safer. So if you want to minimize your risks, it might be worth placing a few extra implants, if possible, of course, and we'd need to make that assessment first. Is All-on-4 best for you, or is conventional implant treatment the way to go? Traditionally, when we used to replace missing teeth with conventional systems, and we would place 5 or 6 or 7 implants and wait longer, because a lot of the times to be able to place implants, we would have to graft bone first and then wait. So there's a time delay. And also there is greater cost involved. Whereas All-on-4, we often place implants deeper into the jaw and utilize what bone there is available, rather than having to graft, and therefore time frame and cost are both lower than with conventional implant treatments. So there are advantages and disadvantages to each option, and we'd be happy to discuss them with you.